Is gluten harmful to autistic individuals? When we think about gluten and its effects, especially regarding autistic individuals, it's important to ask, is gluten harmful? Autism spectrum disorder is a condition that affects how people communicate and interact. Many autistic individuals face sensory processing issues, which can influence their daily lives, including how they react to food and additives. Gluten is a protein found in grains like wheat, barley, and rye. For some people, gluten can cause negative reactions, especially those with celiac disease or gluten sensitivity. In the context of autism spectrum disorder, the question arises whether gluten impacts symptoms. Some reports suggest that a gluten-free diet might help improve behavior and cognitive function in autistic individuals. This improvement could be linked to reducing gastrointestinal problems, which are common among those with autism spectrum disorder. Gastrointestinal issues can often go unnoticed and may relate to food intolerances. The idea is that removing gluten and casein, a protein found in milk, might help by lowering inflammation and enhancing nutrient absorption. However, the scientific evidence supporting a gluten-free diet for all autistic individuals is not definitive. While some people report feeling better on such a diet, there is not enough research to recommend it for everyone. If an autistic person experiences gastrointestinal symptoms or negative reactions to gluten, it might be worth considering a gluten-free diet. This should always be done under the guidance of a healthcare provider. It is also essential to note that celiac disease is more frequent in individuals with autism spectrum disorder compared to the general population. If symptoms persist, consulting with a healthcare professional is vital to find the best dietary approach. From the perspective of autism spectrum disorder, the potential effects of gluten highlight the need for personalized dietary choices. Gluten may not be harmful to all autistic individuals, but it could be an issue for some, particularly those with gastrointestinal concerns or celiac disease. Understanding how gluten and other dietary components affect each individual is key to managing symptoms effectively.